Have you been diagnosed as PCOS? Then how should you overcome the PCOS related problem? Then to know this, please watch this video. I am Dr. Sirisha, gynecologist from Avira Fertility Hospital. So PCOS is a chronic inflammatory disorder affecting the ovaries of unknown origin. PCOS is on high rise in the society. PCOS origin is unknown, but a genetic predisposition is related to this disorder. So genetic, it means genetic if the mother or sisters or your first degree cousins had the same problem, then you also may likely get this disorder. Along with that, a chronic exposure of pollutants and plastic, then pesticides has been with a poor nutrient diet has also been associated with this disorder. Then how should we diagnose this PCOS? PCOS is diagnosed based on the Rotterdam's criteria. Out of this, these three criteria are mentioned. Out of this, if two criteria suffices for this diagnosis. The first criteria is oligo-ovulation or anovulation. It means no egg release, or if very in few cycles egg release is seen. So these can be represented like menstrual disturbances, that can be like an irregular menstrual cycle or excessive bleeding during your periods or scanty bleeding during your periods. So like you can see, there won't be any ovulation during the menstrual cycle. So the next criteria will be the hyperandrogenism, that is excessive hair growth on your face, on your hands, on your legs, then acne, then darkening of your skin, like especially you can see behind your neck and in armpits, in groins. So this is called as acanthosis nigricans medically. So for all this, like the third diagnosis will be ultrasound diagnosis of polycystic ovaries. Peripherally, like if you see the ovaries in ultrasound, your ovary size will be enlarged, and the same time peripherally placed cysts of around, cyst is nothing but the immature follicles of size less than 10 mm of at least 10 should be present. The typical pattern is called as a necklace pattern or beads of string appearance. So if you see a necklace, like how the beads are placed like a peripherally, the same way you can see you can see the cysts are arranged, the follicles are arranged peripherally in a peripheral arrangement. So this will be, so there won't be any dominant follicle seen in this phase. So any of these two criteria will suffice the diagnosis of PCOD. So what happens like if this PCOD left attended? So if PCOD is left attended, it may leads to, the first thing will be the infertility, the main thing. The other things will be a diabetes or a hypertension or a heart problems or endometrial hyperplasia or endometrial carcinoma. So how do the patient present to us? Most of the times some patient do present to us with the menstrual disturbances like irregular menstrual cycle, excessive bleeding during periods, then or scanty periods, or infertility, or with excessive hair growth on your face, on hands, legs, acne, then acanthosis nigricans. So any of these features the patient do come to us. Then how do we treat them? So we have to, can we cure this condition? Absolutely no. So we have to manage this condition. How to manage this condition? First, we have to confirm this diagnosis. We have to confirm this. The main stream of diagnosis will be the ultrasound. The other will be the blood test, like increased LH-FSH ratio, then increased serum testosterone levels. So it also may be associated with altered glucose metabolism, like you can see like in GTT, in glucose tolerance test. Most of the time you see the abnormal glucose levels in your glucose tolerance test. So these will be the diagnostic criteria. So along with that, you have to look for the serum thyroid. Your thyroxine levels will be most of the time normal, and your prolactin hormone also will be most of the time it will be normal. So if you see all these conditions, then PCOS is confirmedly diagnosed. Then you have to manage your condition. So the first thing what we tell is lifestyle modification. Lifestyle modification includes both the diet modification with a regular exercise. The diet modification, we tell them to avoid three things. First thing will be the sugary items. The second thing will be the saturated food items, where you see lot of things in your bakery items and in your junk food. The third thing will be the aerated drinks. that is carbonated drinks. All these like Coca-Cola, Pepsi, all these carbonated drinks contains a high amount of sugar. So we tell them all to avoid these three things. Along with this, we tell them to take a high protein diet and foods rich in saturated fats and along this antioxidant rich diet. So along with that, we tell them to do a regular exercise. So all these conditions will manage their conditions, will reduce the obesity, thus helping the cycles to make them to become a regular thing. Then the thing will be the hyperandrogenism. How do we treat the hyperandrogenism? The symptoms like acne. Acne will be treated by the topical corticosteroids or topical retinol creams. The excessive hair growth on the face, on your body, on your legs, and on your hands and legs will be given will be treated with using the systemic anti-testosterone medications like spironolactone, cyproterone acetate. At the same time, laser surgery is also advised. So all these things, and if you have an infertility problem, then it has to be treated with your first will be the ovulation induction agents. Ovulation induction agents will help to release the eggs from your ovary. So if this method fails, then we go for a simple method like a ovarian drilling method. Ovarian drilling method, we do it in the laparoscopy. We give a light stimulation to the ovaries, thus enhancing the egg release from your ovary. Then it will be combined with ART techniques. So all this, then your diabetes mellitus has to be managed through your diabetologist, taking metformin, myoinositol, or if needed, insulin. So all these things has to be taken care of by the patient or with the support of their family. So if at all any doubts regarding this issue, please post me in the comment box. I will answer all the queries. Thanks for the patient listening.